more of a chronic strain situation, which many of us go through. So we're going to do some basic orthopedic neurological testing here. I'm going to ask Dr. Wheeler to turn his head to the right, and we're looking for restriction in his range of motion. Now he's a little more restricted to the left than he is the right, and he's going to tell me if there's pain with that. Is that painful there?
No, not really.
Okay.
I mean, it's a little bit tight, but...
Okay, this side moves a little freer. Head goes forward. How's that?
Just like, it's okay, just a little tight. You know?
Okay, now we bring his head back into extension. So globally, his range of motion is pretty close to normal. He would really not stand out. Bring your right ear to your right shoulder, and your left ear to your left shoulder, like so. So we're looking at lateral flexion. Now he's had a lot of good care, but he continues to have neck pain. So we're going to test first of all muscles that relate directly to the neck. Now, first we're going to bring his head forward, and we'll be testing the scalene group as a group. Hold right there. Okay, now turn this way and hold right there. Now, as you can see, with his head turned to the right, we're isolating the right scalenes. He's unable to hold that position when I test, and I'm not putting more than a few pounds of pressure. On this side, he's able to get a nice set. Those muscles are able to lock in response to my test the way that we consider to be normal. Now we're going to bring his head all the way forward, all the way to the left, and we're going to be testing the right sternocleidomastoid. Hold there. And that doesn't want to hold. Let's go to the left side. Hold there. That's much better. So both the scalenes and the sternocleidomastoid on the right side are not functioning properly. Now, you can't expect a neck to function normally, support the head, which weighs 10 to 14 pounds. Now hold your position there. I'm going to be pushing straight forward. Okay, I'm going to have you turn slightly. Now I'm testing the neck extensors. Now those don't want to hold either. So we have a lot of things going on here with Dr. Wheeler with his neck. His muscles aren't wanting to hold. Okay. When his eyes go straight up, it causes a weakness of a previously strong teres minor muscle. Now, because we know the directions of the eye movements and their relationship to the upper cervicals, from that it tells us to look at the occiput. We're going to check him for a bilateral inferior occiput, an occiput that's jammed this way. So what I'm going to do is first I'm going to palpate. I'm going to see if it feels like his occiput is moving on his atlas. Now it appears to be moving side to side, but if we tip, there's a little bit of restricted motion this way. Now the rest of his neck seems to be moving pretty well, but right in there is not so good. Now we're going to use our tool of therapy localization if it affects a muscle that wasn't affected by the breath, the teres minor. Hold there. Okay, now hold there. Now that muscle goes weak in the clear. Breathe in, hold, breathe out. And it's unaffected by breath. So something is going on here that is affecting the function of a previously intact, normally functioning muscle. And we'll go back and we'll check that again. So I'm very, very gently going to move that over and clear out some. There we go. Okay. And we'll let that settle in a little bit. Now we're going to retest the muscles around the neck. Now bring your head forward for me. Now that was okay before. The range of motion was good before, but it's just that he has. How's that feel?
It feels a lot better.
It feels better. It's just now he had good range of motion to the right, but he actually has even more now. He's got a nice young neck, and that's pretty good. Now let's go to the left. The left had some restriction. The left is still a little bit less than the right, but it's
Yeah,
better than it was. I'd say maybe 5-10 degrees. Okay, now, but more importantly, remember we tested the scalene muscles. Hold. Okay, good. And hold. Okay, those are both testing strong.
Oh.
Now we tested the, and before the right was weak and the left was strong. We tested the left SCM, sternocleidomastoid. It was strong before, it's still strong. And the right sternocleidomastoid, strong. So it has corrected, that adjustment corrected and alleviated the muscle weakness that we had going. Bring your head back. Now with these, okay, neck extensors on the right, neck extensors more to the left. Those were all testing weak before, all testing functionally, neurologically inhibited before. They're now testing strong or normal. Now that was just from one adjustment